Ladies, let's talk about it. Vaginal discharge. What is your vaginal discharge telling you? What is abnormal and what is normal vaginal discharge? And when should you really go and see your doctor? Hi, and welcome to Dr. Monique's Forum. I am Dr. Monique Campbell. I'm currently working as a general practitioner, but I have also subspecialized in public health. I have previous experience working in surgery, and especially related to this video, I have previous experience working in sexual health or STI clinics. What is normal vaginal discharge? Now, normal vaginal discharge can be white or clear, almost basically looking like egg white. It tends to be non-malodorous or non-offensive. It will not smell like roses, but it should not be offensive. Okay, it is acidic in pH and occurs from just a normal self-cleaning process of the vagina. Consistency will vary, so it depends on where you are in your menstrual cycle, if you are pregnant, or say for example if you're sexually aroused. So that is normal vaginal discharge. So we are now going to move into abnormal vaginal discharge. So the first that we're going to speak about is if you're experiencing a thick, curdy, lumpy, cotton cheese-like vaginal discharge that may be white or off-white and may be associated with itching or burning to the vulva, redness to the lips or the same vulva of the genitalia, painful sex, then this likely indicates that you're having a yeast, a vaginal yeast or thrush. Treatment usually involves getting oral antifungals or pessaries. The pessaries are inserts or tablets that you would put up inside the vagina, or you may actually be prescribed creams or gels that can be used on the lips of the genitalia. Now, the second that we're going to be speaking about is if you're having a gray or white, watery, or profuse watery vaginal discharge that is fishy. This indicates bacterial vaginosis. Now, bacterial vaginosis is not an STI or it's not a sexually transmitted infection, but it is a sexually associated infection. What does this mean? It means that it occurs in females who are sexually active. It usually occurs because there's an imbalance in the pH inside the vagina, and this causes overgrowth of the bad bacteria. So basically you're going to have more of the bad bacteria being produced than the normal bacteria that is normally resident in the vagina, that is good and protective to the vagina. And you may recognize that it tends to be more fishy during sex or around the time that you're going to have a bath or a shower. And this is treatable. So treatment is usually by antibiotics that may be oral or may also be pessaries or inserts inside the vagina. The next we're going to move on is to talk about if you have a very profuse, malodorous or offensive, frothy, yellow or yellow-green vaginal discharge, then that may be associated with vulvar redness. Then this normally indicates Trichomonas vaginalis. This is an STI. Okay, it's a sexually transmitted infection, and actually it is the most common vaginal infection worldwide. So it is transmitted by a protozoa, and given that it is sexually transmitted, then that means that your partner needs to be treated. Around 90% of all vaginal infections can be attributed to all three that I've previously discussed. That is vaginal yeast infection, Trichomonas vaginalis, and also bacterial vaginosis. Other Other vaginal discharge that may be STIs include discharge that is purulent, it actually looks like pus. It is pus, yellow. So it's a yellow vaginal discharge, and usually may be associated with painful sex, burning on urination, abdominal pain, and in certain extreme cases, a fever. Persons may also experience, or ladies may also experience, bleeding between period, or also bleeding during or after sex. And this is usually attributed to or indicates chlamydia or a gonorrheal infection. Interesting to know though that although you may present with these symptoms, around 70% of persons with gonorrhea or chlamydia, it may be asymptomatic. That is, they have no symptoms at all. So that brings me to the importance of your routine STI test as long as you're sexually active. Treatment of the STIs will include treatment of both partners. And so it is recommended that you avoid sex at least for a week while you're being treated. If untreated, then this can lead to complications such as pelvic inflammatory disease, where you have significant or chronic pain in the pelvic area or abdomen, and even in certain cases sterility, and I know that you would not want that. So if you're having any of those symptoms, it requires that you see your doctor. We are now going to move on to last abnormal discharge that we're going to be discussing, and this is if your vaginal discharge is red. Well, sometimes when the vaginal discharge is either red, pink, or brown, it can be normal if it is occurring, say, at the beginning or the end of your menses or the period. Especially for the brown discharge, it just means that it is blood, that the flow is not as heavy and it can be oxidized, so it turns from red to brown, that you may notice on the underwear. So in that case or scenario, that is abnormal and you do not need to see your doctor for that. However, if the following occurs, or if these then you need to see your doctor, which means that these are abnormal. If you're having a red vaginal discharge that is occurring between your periods, or you're having intermenstrual bleed or spotting, for ladies who are menopausal, if you're having a postmenopausal bleeding, so that is bleeding after menopause has occurred, bleeding after sex, and also bleeding during pregnancy, this means that you need to see your doctor. After discussing our abnormal vaginal discharge, then I also want to discuss things that you can do at home to minimize your risk of getting abnormal vaginal discharge. And the first that I'd like to discuss is actually feminine hygiene. So certain feminine hygiene tips or self-care tips will include, firstly, wearing cotton underwears. Ladies, cotton underwears is your friend. Just allow the kitty to breathe. Please wear breathable underwear. And if you are wearing underwear that is not cotton, some of the other fabrics such as satin, it will actually trap moisture and will cause overgrowth of bad bacteria that can produce vaginal odors and abnormal vaginal discharge. The next important feminine hygiene tips include, after using the toilet, remember to wipe from front to back, because wiping from back to front may cause bacteria from the anus to be moved into the vagina, producing abnormal vaginal discharge. The next is to avoid douching or avoid washing up inside the vagina. Remember that the vagina is actually self-cleaning, so there is no need to be washing up inside the vagina. That's actually going to alter the pH balance in the vagina and destroy your normal good resident bacteria that is found in the vagina. That, remember, I have said before that those bacteria are protective. The next is to avoid scented bath products, scented bath or feminine products, and to change sanitary pads or tampons frequently when you're having periods. And the next tip is actually safe sex, so that is condom use. So regardless of if you're using other forms of contraceptives, all other contraceptive methods will prevent pregnancy, but they are not going to prevent getting a sexually transmitted infection. So if you're having any of the abnormal discharge that we have discussed, I would advise that you see your doctor so that you can be properly assessed and treated. Thank you for watching. I hope this video was helpful to you. If you like my content, please like, subscribe, and share. And please stay tuned for other great content. Thank you.